my name is Michelle, and today I'm going to be going over MMT for hip flexion and extension. Ozzy is going to be my patient here. If you could lie on your left side for me, please. Okay. I'm going to be stabilizing her body with the lower leg on the table, bent at an angle. To do hip flexion for a grade of trace, what I want to do is palpate the psoas major muscle, and that's located inferior to the inguinal ligament, which runs along here, and it's also medial to the sartorius. So I will be feeling for the psoas major in this region. If I ask Ozzy to try to bring her knee into her stomach for a trace grade, and I can feel the contraction of the muscle in the psoas major right here. Now to test for a grade of 2 in the gravity minimized position, I'm going to support here, and I'm going to say, Ozzy, can you bring your knee towards your stomach? And I'm going to also make sure there's no rotation of the pelvis and that her trunk is in line with the rest of her body. I'm going to stabilize the hip and say, can you bring your knee to your stomach? And back. Relax. Okay. That is hip flexion for a grade of 2, gravity minimized, through the full range of motion. Now to test for hip flexion for a grade of 4, if you could sit up for me with your knees hanging over the edge here. Alright. Okay, now I'm going to support at the hip and trunk. If you could bring your knee up into my hand. Alright, that's a grade of 3 for against gravity, full range of motion in hip flexion. For a grade of 4, I would add some resistance. I'm still stabilizing here. And adding my pressure proximal to the knee. So if you could try to do the same thing this time, and I'm going to add a little pressure. So fight what I'm doing. Push, 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 and relax. Okay, one more time. Push, 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 push. Okay. Now I would also test the opposite leg, since that was a grade of 4, to make sure it's, so I know the difference in strength, whether it's equal or one side is stronger than the other. So same thing, if you could bring your leg up for me. Okay. And one more time we're going to do pressure again, so push. All right. And that is hip flexion, a grade of 4. The next thing we're going to do is hip extension. So if you could lie back onto your side for me, Ozzy. Okay. Now, hip extension for a grade of trace, I'm going to set up the leg the same way to stabilize on the bottom. For a grade of trace, I'm going to palpate the hamstrings and the gluteals right in here, as I ask Ozzy to see if she can bring her leg back towards me. And as she tries to do that, I feel a contraction right here in those muscles. For a grade of 2, which is gravity minimized, hip extension, I'm going to stabilize the hip, support the limb, and I'm going to have Ozzy bring her leg back in towards my body. So push back towards me. Okay, relax. I need to make sure that she has her trunk in line. So we're going to do that one more time. Push back into me. Okay. Relax. Alright, that's gravity minimized hip extension. The next thing we're going to do is against gravity. So if you could flip onto your stomach for me. Okay. Hip extension. What we're going to do is I'm going to stabilize above the hip, and for a grade of 3, I will see if Ozzy can raise this leg up to the ceiling for me, keeping it straight. Alright, so that's a grade of 3 for hip extension. If I'm testing a grade of 4, I will add some resistance and this location, still stabilizing the hip. And can you do the same thing for me? I'm just going to push down. I still want you to push up. So push, 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 and relax. So that was a grade of 4 for against gravity. Another way to do a hip extension is to isolate the glutes. And for that, I'm going to have you bend this limb and say, can you please lift your leg in the same motion again? All right, that's isolating the glutes. I can also add some pressure and do the same thing. Raise your leg. And as she does that, I feel a contraction of the gluteus muscles located right here where I'm stabilizing at the hip. And that's the end of my presentation. Thanks.